This evening, I want to welcome two rising stars in periodontics, Dr. Dinoi and Dr. Castillo. I'm honored to be working with both of them, Dr. Dinoi in Murray Hill location on 35th Street and Dr. Anamaria or Dr. Castillo on 933 Fifth Avenue. You, Cinzia, I know you for the last 13 years when you were my first class that I graduated when I was running the program at NYU. And you, my dear Dr. Castillo, I know you for the last 4 years. So I know both of you. A lot of people don't know you. So what would you like for the listeners to know about you the first time? So let's start with you, Dr. Dinoi.
To know about me.
In your journey of dentistry.
Well, I went into dentistry because I've always loved medicine. But then one day I was fixing my bike and I thought, I really have to do something with my hands for the rest of my life. And it was last minute. I had the two applications there, dentistry, medicine, and I picked dentistry. And I think that was the right choice.
Excellent. And you, Dr. Castillo?
My family has a extensive medical background, and I have a brother with severe special needs. So my parents were their primary caretaker, my brother Tony. And growing up, it always felt very medical in the home. Like he feeds through a GJ tube, he's in a wheelchair. So my parents always took care of him. So I knew I always wanted to be a part of the medical field. I went on a mission trip, however, and they had a dental component. And I realized that you could really transform quite a number of lives in one day. So I led more towards dentistry, and then with periodontics, I feel as though that really is a nice harmonization of medicine and dentistry.
Excellent. There was any moment when you realized that this is more than a job?
Well, as you know, I'm Canadian.
Mm-hmm.
But then I lived in Italy extensively for most of my youth. When I moved to the States, of course, I had to requalify, right? And at that point, all the doors are open to you, especially in New York. I mean, I could have gone into marketing, I could have gone into fashion, I could have become a chef. You could do anything. I mean, it's like starting over again, like you when you came here. And I realized that, no, I didn't want to let go of it. And so that's when I realized it was more than just a profession. It wasn't really interchangeable with any other profession for me.
Well, we're going to go back to that Italy and Canada and all that thing. Dr. Castillo?
I used to always pray and be like, where does God want me to be? And what's my purpose in life? I see my parents were very fulfilled in their careers. I was raised to be very career focused. With dentistry, dental school was tough, getting into dental school, trying to study and be disciplined. But I always enjoyed it at the end of the day, even during stressful times, difficult times, even to this day. So I feel like this is what I was called to do.
So who were the biggest influencers or mentors early on, and what lesson you learned from them that shaped you in how you practice today?
Well, early on, my career was in Milan, Italy, of course. And I still think of those mentors I had there at the beginning, and we're still so close. Like I visit them once a year, and they're always so happy to see me and I them. So they've been really significant figures in my life. And also, I don't know if you know this, but do you know my parents left me in Italy at a certain point?
I know.
They went back to Canada, and I was there on my own. I was like this early 20s, and they really took me under their wing, not only professionally, but also just all around, So I'm very grateful for that. Yeah.
And you, my dear?
I've had mentors, I feel, in different chapters of my career. My dad is a physician, so I see him waking up at 4 o'clock in the morning, putting everything into his patient care. So that discipline and humility has really shaped me. I had an excellent pre-doctoral director at Temple. during dental school, and she really set the foundational knowledge for periodontics, how to do a comprehensive exam, how to pour excellence into everything that we do. So that was really helpful in shaping me. And throughout my surgical training at Stony Brook, similar to Dr. Dinoi, mentors are so important. It's very important to keep in touch with them and to get feedback from them. So I'm multiple mentors throughout my career.
So let's go back to that Italy story. So let's shape it up a little bit.
Okay.
Your parents, both of them, are Italians.
They are Italians,
Right,
yes.
right. Why don't you loosen up
I'll
and
get
start
into
talking? So, but they immigrated to Canada. You were born in Montreal.
Exactly, yep.
And then you did your high school here in Canada.
In Canada.
Here, for me,
Yeah.
I always confuse here, North America. Because nowadays it's very touchy about Canada.
Yes.
So you did your high school in Canada, and then your parents decided to go to Milan. Just explain that to me.
So basically my father, he hates the cold, especially the cold we've been having here this past few weeks. And so he always had this dream of going back, because, he had realized himself, he was a chemist. That's what he came as, a trained chemist. And he, in the industry, he had all his satisfactions and he was ready for another stage of his life. So it was like, let's go back to Italy, Milan. And so we did. Now, mind you, I did 2 years of university in Canada. So I was about 19 before moving to Italy, and my major was math and statistics. I love math.
So that's what we have another in common together.
Yes.
So that's how you guys ended up going back.
Yeah, that was the reason. And then, so I applied to Italian dental school. Mind you, I was happy to go because I spent all my summers there. I mean, it was not a problem getting me to move to Italy. So then after a couple of years, my dad's like, you know what? Let's go back.
Back to Canada.
And I'm like, what? And he's like, well, when you're done here, you can just, get qualified or, in Canada. And I couldn't believe it. I'm like, you just yanked me out of university in Canada, starting again in Italy. And then, you're going back. So that's why I was there on my own. Now, I was perfectly happy there. But I met my husband this down the line after finishing dental school, and I had no intention to go back to Canada at this point, who's American, and that's why I ended up here. He was my roommate, actually. Yeah.
There you go. Something comes out of being a roommate. So
yes,
that's not a
for
bad
sure.
thing.
For sure.
Alrighty. So let's go into dentistry now that we talked about the personal stories, unless we are missing something with you, Dr. Castillo. Nothing about Italy.
No.
Moving there. Okay. Alrighty. But we're going to get to Rob, so hold on. So being a prosthodontist in today's landscape, we're going to cut this off, okay? Being a periodontist in today's landscape, dentistry have changed. I can't talk about myself, but I'm way much older than you. When I trained, we have all kinds of technologies, softwares, planning, 3D printing, whatever. Okay? So what do you think defines this generation of periodontists?
Periodontists specifically? I mean, we have so much available to just like fine-tune things that I don't feel we had before. I mean, we're a little more limited. But you have to know how to use the right tools at the right time. And I think a lot of people make mistakes there. They're like, robots and implants, they're going to be the future, so you got to learn that. And, they're training kids in university to use them. But I found that to use a robot, you really have to know what you're doing before using the robot.
Correct.
Someone off the street cannot come in and use
Correct.
that to place implants.
That is so correct. And what do you think?
I think that our generation, it's exciting, but it could also be overwhelming in terms of everything that's out there and the need to master that. But I think going in, knowing how to use things and get the proper training and whatnot. I mean, materials have changed over the past 20 years, and I'm sure things are going to continue to change as well.
Well, that brings us that if you don't know the fundamentals, doesn't matter if you know the robot or not. What if the robot doesn't work?
Exactly.
Happened to me last time. So
exactly.
and you have to fall back onto your skills and then move forward with it. So what's the new challenges you think that the new dentist or the younger dentist are facing versus the ones that trained before? So let's start with you, Dr. Castillo, about that.
I think you have to be adaptable to everything that's coming out and to stay current. I mean, in the beginning of my dental school education, all my older attendings were like, oh, digital dentistry, that's, it's a cool thing, but it wasn't going to be utilized. But you can't go to a conference today without not seeing a single element of digital dentistry or digital workflow.
So you think that the newer generation are more adaptable than the older generation?
I think so.
I agree with you. And what do you think?
I think that one issue is that the younger generation has a lot of it's very tempting to kind of do everything. Do orthodontics with Invisalign, do, endo with, now they have those, everything's just easy. Rotary instruments. When we went to dental school, we didn't have those. So I think the problem is that these young colleagues think that they can become specialists, in a weekend or in a few lessons that they take in a particular specialty. And I'm afraid that they don't realize what they're getting into sometimes. And as you know, we fix so many mistakes in our practice, Right. So, and I think a lot of that is due to this problem. Yeah.
Look, there is an abundance of information out there and availability, and look, I'm mea culpa. At the beginning, I was teaching in CE, continuing education, and I stopped because, and I wrote it in my book. It's one day I was giving a course, and I realized that the guys that were taking the course with me didn't know how to make a 3-unit bridge. That was the last time I gave a 2-day course for implant placement and stuff, because I still believe that, as you said it, in order for you to really master anything, you have to. There is a reason why people go to a specialty program. So today also there is another thing in our landscape that is changing, which is there's the student debt. There is corporate dentistry on top of the rapid technology. Okay, so we talked about the technology. It can be adaptable. We need to be adaptable to it. But also the new or the younger are facing those two challenges, which is the debt and the corporate dentistry. So in your opinion, what do you think should happen in the future?
What should happen?
Yeah, or how can the younger generation deal with that fact?
Well, I think, again, it's very easy to fall into a trap there and, see everything through an economic lens. I have to pay my debts. The corporate world is offering me, a nice salary and so on. But two things, you risk, you risk losing your own dreams. It's got to be your dream, not someone else's. And I feel like the DSOs, that's someone else's dream, to make a lot of money by just like automating everything. So yeah, you have to be careful and stay true to yourself and like not sell your soul, basically. Yeah.
And Maria, what do you think? You're more involved in organizations and stuff. So what's the advice or what you think that should happen?
I think when choosing a practice to work with, just as much as you're a representation of that brand or that practice, I think it's bi-directional. So going in and looking at jobs saying, is the structure, is the schedule, can I see 5 patients in the time that they're allotting me to see those patients? I think you need to look at your ethics. I think it's a very personal decision. A lot of my friends do work at DSOs. I mean, the debt is crippling. I'm not going to lie to you.
So you think that the debt is the main driver?
I think it's a big driver, definitely, especially in today's economy. You can't deny it. You're coming in, especially people around the Northeast region. I mean, we've spoken about this, $700,000, $800,000 plus, not even including undergraduate loans. So, if you have a single individual that's maybe not married, doesn't have family wealth, so on and whatever their situation may be, it's a burden for a lot of people. Patients equal profit, and it could look at patients equal experience, which is what I like to see as, I'm in that period of my career where I want to see and do as much as possible and learn as much as possible. But to others, it's very easy. It's a fine balance where it can turn towards profit. I can see how it can happen. But again, seeing is this practice aligned with where I see myself and what I need as a provider.
Okay. So now we're going to move to the clinical philosophy and patient care. So how would you describe your philosophy of patient care? So let's start with you, since we left it with you.
I think it's periodontal disease affects so many people, and so many times patients come into our office and they don't know why they're there. So for me, education is very powerful. Educating the patient not only builds trust within that relationship, but also letting them have ownership and autonomy over their decisions moving forward. I think with our specialty specifically, it's very relational. We see patients on a very routine basis. So, it's not just coming in and getting cleanings, but why are you getting cleanings? Why are we so in tune with everything that we're doing? So that to me is very, very important.
And you, Dr. Dinoi?
I think it boils down to, what would I want for myself or my sister or my mother? I always ask myself that. And then I just translate it to the patient and try to personalize it to the patient, right? Because everyone has different wants, needs, aesthetics, or some people just want health. They don't care about aesthetics. So you got to see who you have in front of you and really tailor the treatment to them. And then at the end of the day, if the patient's not happy, I'm not happy.
What does excellence in dentistry mean to you beyond just technical skill?
I'll follow up on that with, I think, the personalization, which
personalized care.
Yeah, personalized care, 100%. Because, you can take a course, everyone can do something, 100, 200, 300 times, become good at it, but it's not like that's the solution for everybody. And, listen to the chief complaint. That is something that I think a lot of dentists don't do. And they're going off on a tangent and the patient wants something else.
So, yeah, definitely listening and personalize the care. That's what I see the theme. And it's actually part of our branding in our practice is personalized care. I'm glad that you said it without me trying to preach it or fish it out of you. So it's the same team. How can we make the patient, or how you think you are making the patient, trust you and feel like this is not a transaction, but you care about it? So what's your message for that?
I never want a patient to feel rushed in my chair. I want them to feel comfortable, because it's very intimidating. I think dentistry in general, let alone surgery. Again, and it goes back to education. Patients don't know why they're there. They're very fearful. But trust is very important to me. I think that if a patient can trust you to service them, to work with them, I mean, that's such a privilege. And it's something that really motivates me every day to be better than we were yesterday. And it's a sacred thing, but it's also, it takes time.
And you, my dear?
I think that trust is kind of also based on results. You know, that's in the end, a treatment plan delivered well with following the patient's expectations. You know, I love it when a patient says, "This is what I was expecting, and that's what I got." You know, that's. So that's one aspect. The other is just a gut feeling. I think they just kind of, I don't know if it's body language or what it is, but patients perceive if you're being honest or not, or, you know, if you have integrity or not. I always say, you know, a dentist is like a mechanic. We can tell them anything's going on in their mouth, you know. So they really, you know, it's really important to build a trusting relationship. And if you do, they're going to keep coming back.
So, reputation. At the end of the day, you are building a reputation. It's the same thing as they call it branding. It's reputation. In healthcare, it's reputation. Now we're going to move to partnership, mentorship, and growth. You and I work closely together. I spend time with you and spend time with you. From your perspective, what makes a successful partnership in dentistry? Who wants to go first? Why? Because I know her longer?
You know, a successful partnership. Certainly, one thing is you really have to like the people you're working with.
Indeed, yeah.
I think that's fundamental, you know. And for me, I have to know that they have integrity, you know, and that their goals are the same as mine, you know, delivering the best possible care, but still making the patient comfortable and being there for them. I mean, everyone has to be on the same page.
Both of you are at different stage in your career and time and all of that. Does mentorship, or let me rephrase it, is mentorship as important to you right now? And do you think mentorship is also important to you even after 13, 14 years in private practice?
I think mentorship's always important. You know, there's always someone who's going to know more, have more experience, and we have to take advantage of that, right? I think that's it's a gift when someone is generous with their knowledge or with their life experience. And as far as mentorship goes, you know, I like advising the younger colleagues on like which specialty would be right for them and to stick with it. I've written tons of letters of recommendation. I think it has a role no matter your age.
And you, my dear?
Yeah, I think mentorship is critical for any stage of career. There's always someone that getting feedback, hearing different life experiences, patient experiences. It's invaluable.
What I'm hearing from you, it's that we have the ideal world. We are, you know, we kind of bounce ideas on each other if you want. And we kind of, we have three different kind of longevity of work, and we can bounce back. And that's the beauty of working as in a team or in a group, basically. So a young person coming out of school, what would you recommend for them to look for in a mentor? Start with you. We've been starting always with Cinzia.
I think making sure there's an alignment in terms of personality. I think also being self-aware in where you are and what your expectations are in terms of not what to get out of the mentorship, but what your goals are with that relationship. And then ultimately making sure that there's a management of those expectations amongst mentee and mentor.
Okay.
Yeah, I agree with Anamaria that your mentor has to know you well. I mean, they kind of have to know your ins and outs. Otherwise, the advice isn't, again, personalized, right?
True.
Always back to that. Yeah.
So we have dedicated surgical hubs, the 2 locations. Why do you think this matters clinically for a patient? Because, we are in an environment where some people bring periodontists in their office and endodontists and so on and so forth. They mix everything together and stuff. So why is it important for a patient to know that going to a dedicated surgical hub is important?
Well, in my past, I did do that consultancy for GPs, in all the boroughs of New York. I think we've all passed through that
I
phase.
beat you all. That was the first.
Yeah, and I have to say, having a proper surgical assistant, super important. Best compliment I can get is when, the patient notices how in line I am with my assistant, how we just pass instruments to each other. I don't have to say a word, and she knows what I'm thinking already. So that's super important. Also, what was missing in those practices was all the possible, tools we can use, the digitalization, robotic components, even variety of instruments. That was missing for sure. And then also for emergencies, just having, something that you can cauterize with if you need it, or, certain things I wouldn't undertake in that sort of practice, certain levels of.
Me see what she thinks.
No, I agree with Cinzia completely. From the surgical assistant, patients pick up on that. Like if you're in tune with who you're working with and the flow of the room and the treatment. It's also really nice because you have everything if there's an emergency, or if plan A needs to go to plan B and plan C, that you have everything literally at your fingertips.
And the most important thing, the cleansability and the sterility of the place. You don't mix powder that comes from drilling teeth to surgical rooms, so it's important. Now, let's get to the leadership and culture. A lot of us, we were trained to be, to master clinician, to master the clinical skills. But yet, when we go to real world, we need to face leadership, and practice culture becomes important in our life. So when did this start showing up for you?
I think, I don't know how to start this, I'm sorry. All eyes are on you, but they don't necessarily need to be on you. If something's missing from the room, the patient's not going to say, oh, Jen or someone misplaced something or something's out of line. They're going to go to the doctor. I think it's very natural for that. So that being said, you set an example and a certain standard. There's a big difference, I think, between a boss and a leader. A boss will more or less tell everybody what to do. I really am a firm believer in servant leadership, showing the team how to do things. Let's all work together, because at the end of the day, there's no hierarchy amongst the team. We're all wearing the same uniform. The patient is the most important. So our goal is to provide the highest standard of care for that patient.
I guess early on, I had that kind of idea that, I wanted to give some sort of imprinting to the environment that I was in. I don't know if you know that I was chief resident.
Yes.
You did.
Yeah.
And that's the reason why, though, because
You were my last class that had a chief resident.
Yeah. I meant, no, but of course you would know. But then when I had my child, I stopped and I passed the baton to a colleague. So, yeah. But anyways, for me, leadership in the office is kind of, and you do this excellently, is like kind of keeping the morale up and setting the tone of like mutual respect and, people feeling free to bring up any issues. That for me is leadership culture in the office.
See, it's important to, now there's a big words and buzzword like feeling comfortable, feeling safe, feeling welcomed, feeling this and feeling that. That comes with the culture, and the word culture is really big. Like people feel like, what is it, culture? What do they mean by that? Meaning, in my opinion, it's very simple. If you come to this place where you're going to work, either you feel it's your family, a family that you love, because sometimes you'll be in a family that you don't love, but family that you love and you can cherish and you can flourish. It's as simple as that, in my opinion, as culture. That's I don't know if you agree with me on that, but
yes, like you have to feel like you fit in, and actually, that brings me to why I chose perio also initially. Besides, I was obsessed with it, I loved it, but my colleagues were the most similar to me than other colleagues, like ortho or prosthodontists or whatever, like just personality-wise.
Yeah.
So
you felt home.
Yeah.
What kind of a leader would you aspire to be? Each one of us is a leader. Think you've thought about it? Come on, Anamaria.
I love servant leadership. Like, you saw me the first week I was there. I was cleaning the Langer's ops, like on my hands and knees, wiping down things because, it's one team together with the same purpose, same goal. But also, like Cinzia was saying, creating an environment, not to use the buzzword safe, but you want your team to feel comfortable. We're together so much, 8 hours a day, and what we do is hard, not only technologically speaking, but also like different operatories may bring different vibes, let's say. Like one patient may be celebrating a milestone birthday, another patient may be celebrating or mourning, the death of a loved one. So it can vary, and it's very taxing, I think, as providers, but then also our team. And then I also think making the team understand their value and that they're a part of this team and that, we see the value that they bring. Because for me, personally speaking, I say this all the time, without my surgical assistant, Christine, or without my team, I'm nothing. I can work, but it's not nearly as enjoyable.
I think it's important to set the example as a leader, not expect someone to do things that you wouldn't do or vice versa. It's more, it's kind of, that's it.
So do you think that we are achieving that in our practice? I hate to call it Edgard El Chaar, the DSPC, but
sure.
In our practice, do you think we were successful to do it?
I do think so because, you're so dedicated, and it's not like I wouldn't be, but that's what aligns me with you, right? So that's really important. And then just the striving for the best possible result, so much in common from that point of view. And I think the whole team realizes that. Even the assistants, even the technician, everyone realizes that.
What do you think?
I agree. I think everything, you set the tone, and I love coming to work every day.
Yeah, no, it is. We spend, as you both of you talking, especially sometimes we do surgeries 3 hours, and it's very delicate, and we are suturing, and we're doing this and that. I tend to make a lot of jokes and pick on everybody because that's what keeps me going. So in a way, if you don't build that trust that this person really care about me, just playing with me, it doesn't make it work. And so we spend more hours with them than we spend in at home.
Yeah.
Yeah. So now we're gonna move a little bit more into still same thing: identity, representation, legacy, kind of these deep thoughts. And then we swing back into a little bit of technology, and then we start closing it. Every generation reshapes the profession, right? Some generation lives longer than others. What do you hope your generation will contribute to dentistry? Let me tell you, for instance, in periodontics is different than probably in prosthodontics or endodontics. Probably not, but we are in our cocoon. So if you think about it, when I was in my 20s, Dennis Starno was in their 40s, late 30s, early 40s. Never forget it. Nobody have heard about him, and he started being heard. Just an example. And I lived with him, and there was the Langers. Funny how small world. And then I remember vividly one day I was in my 40s. I was moderating for the Langers, who was in his late 70s, and Tarno not far away from him. So some generations move up fast. Some generation takes longer to open up the space for younger generation to flourish. Professions cannot flourish unless we have a new blood coming in. Nobody can last forever. So in that perspective, do you think what I went through as an experience, probably you got it entail, you did not have to see it because it was younger. Do you think that in today's world, it's easier to have more newer blood coming in and influencing faster, or it's the same old thing? It's a tough question, I know.
It really is.
But that's why we have the podcast, no? We're talking generally. I'm not talking about, doesn't mean that was wrong, that they lasted longer and all of, no, just I'm saying is we need to have always, I need to have somebody. I mean, I'm not going to last forever. So this is this thing. How can we always have this newer blood coming in and rising up and flourishing up? Because in my opinion, I always used to tell the residents that I trained that you are the future leaders. Nobody can last as a leader for the long time, forever, So do you think that the new generation will be able to recycle faster because of the social media, because of the way information is disseminated, with its own risks? We're not saying it doesn't have no.
Yeah, I was thinking of that it's so much more of a jungle out there in so many ways, right? With the social media, and I mean, you don't even know what to believe anymore, whatever you see. I mean, I think they have a challenge, the younger colleagues coming up in like making their mark because of that. I think.
Meaning, if they are not outspoken on social media, they are never going to be known.
Exactly. It's
So the
almost.
challenge is worse now than
I
it
think
was
it is.
before.
I think it is,
Interesting.
because if you don't have a social media presence in many professions, it's like you don't exist.
Interesting.
Like, I have a friend who's an architect, and he doesn't have a website, and
Wow.
the kids, but he's so good that, word of mouth, he's very successful. But the young kids come, and for them, they don't care about seeing a brick and mortar office. They want to see a website. That's how you exist. And I think that's...
Or even Instagram now.
Yeah.
People,
website, Instagram.
I remember on Thursday, I was on this beautiful wine and a Bordeaux wine, and the lady, the winemaker, she's 9th generation. So I went to her and I said, I loved your wine and so on and so forth. And she said, you should come and visit and so on. And so the first thing she told me, instead of giving me her card, she said, do you have Instagram? I said, who doesn't have Instagram nowadays? Yes. Said, follow me on Instagram and I will send you a message. Yeah. Okay. So that's why I'm bringing up this conversation is that, okay, we've grew up on a different way. There was gurus and they were the mentors. They probably took them a long time to allow younger blood to come in. But now it's an open
field.
How is it open? Where is it? So how can a talent be found? A talent that we go back to the same thing, respected, trusted, cares, ethical, and so on and so forth.
Exactly.
Yeah. So, which brings us to the same thing is that how can a patient make a decision?
I mean, a lot of patients find us through our, social media too, besides word of mouth, right? I would say more word of mouth. And I like that as a calling card better.
Because that's how we grew up at that time, word of mouth. But see, this is an interesting thing because if you read about marketing, and you hear me a lot of talking about Gen X and baby boomers. Gen X and baby boomers, they might catch you or find you on Instagram, but they will not come to you unless they ask somebody that has experienced you. I'm finding the tendency in the millennial and the Gen Zs that they will go more towards the social media without asking about the person. Do you agree with me or I am wrong? Because you know them more than I do. You and I, we know them differently. So what do you think, Anamaria? In your generation will be more influenced by Instagram directly without the word of mouth or without asking or?
No, I agree. Social media, if you don't have social media, if you don't have a platform, it's like you don't exist. So a lot of younger patients, they'll look for, at the very least, a website or like a Google review page, but a little bit more with the social media presence as opposed to word of mouth.
Mm-hmm. So how can we validate the trust in this? You know what I'm trying to say?
Totally. How do you know from a website that it's the right thing for you, the right fit
or
for
in
you,
Instagram,
or Instagram, whatever. Yeah.
I would never go and dance a clip and put myself on it because it's not me. It's not how I represented it. This is the way somebody will look for a. I was looking at these 3 surgeons. I'm not talking dental. It's cancer surgeons, 3 young ones, and they are dancing.
Cancer.
Surgeons. Doing the dance, prostate cancer. Yeah, they were dancing. I don't know. I was looking into Instagram and popped up for me. And it's like I said to myself, it's like, am I becoming an older generation that I can't see myself going to somebody like this, they might be great. I'm just saying this is how can we portray ourselves?
So I think it just hit me now, reviews. Because I'm thinking, how do you pick a pizzeria? You look at the reviews, right? You look at the 4.9, 4.3. But then...
It's funny, I've never done this.
Oh, you've not even done that? Oh, my goodness.
I don't even look at the reviews. I'm sorry. I'm saying is I'm probably old, I don't know, stupid or
well, no.
But I walk into a place and I feel, if I feel it.
Mm-hmm. But the problem with reviews is they can be fake reviews, right? So that's also, dangerous out there, especially in the medical profession. But what I do is I look at the bad reviews because the bad reviews tell me what's really going on, and sometimes they're like, oh, they're always late. Well, maybe they're just doing a really good job. That's not going to change it for me. But I look at the bad reviews. That's what I do.
Interesting. So do you look at the reviews?
It's like if you have to pick a pizzeria, what do you do?
I don't do that.
You ask me.
I'm just, the reason I'm bringing it up because, as the title of this question is identity, representation, and then there is the legacy point that I'm going to ask you about. We've living in a different world. I learned one thing in life. You never criticize the world. Like I remember when veneers and all of that started popping up. I was like, your teeth are beautiful. Why are you doing it? And then I realized it's a demand. It's a personal demand and people feel better about themselves. So that you cannot change. And I learned to adapt to it. And the question is, yes, you said education, right? Education to patient comes, they don't know exactly what it is and so on and so forth. You are telling me reviews, okay, plus some minuses about it. But we are healthcare.
Yeah.
Dentistry is healthcare. So where is it?
I think my dermatologist I found her through social media during COVID. She had a smaller platform than she has now, but I did my research on her. I heard more about her story, went to her website, saw her credentials, but her social media platform is ultimately what brought me in. And then when she opened her own office and I went for that first appointment, she was everything that I was seeing online in person.
So
it was very genuine and sincere. Absolutely. So I'm a patient for life with her.
Yeah, see, my first thought was, you've got to give me the name of the dermatologist because it's like word of mouth.
Yeah. Oh, I give it so many patients. Shireen Idris.
That's the first thing that popped into my head.
Dr. Penn. Oh, wait, HIPAA. Dr. Penn's Goner.
Yeah. So what kind of, that's a little bit, what do you think in 10 to 15 years you want people to say about you when like I had this amazing periodontist, or I had the worst periodontist. I'm feeling
not the worst.
But what do you think you want people to think about you?
I'm at a point in my life where I feel like I have a team, from the real estate lawyer to the pharmacist to the, PCP, et cetera. And I feel so confident that I can solve any problem that occurs in my life because of my team. Like even my pharmacist, I love my pharmacists. And I love them because they are, a homegrown,
it's a
operation.
It's a
private one.
There you go.
And that makes, they make my day, like just that interaction. What is that worth? And so I think that I would like it if, my patients or whomever just says, I loved my periodontist.
And you, Anamaria?
I want people to enjoy coming to see me. I often kid with patients, it's like you're not dying to see me, but I hope through those subsequent visits and just, again, establishing a relationship with them, that eventually they love me as well. And like, you're known for providing excellent, empathetic care.
It's a very important thing, because this is how you shape every day your treatment and your care. You know, we talk about treatment and care. Are they the same? You know, I'm a little bit more philosophical, I said tonight, so I don't know why, but because I feel comfortable with you both, and I think you're too smart, and that's why I love to do this philosophical thing. But the care and the treatments, I think they're different.
Definitely different, because care is like, and I'm sure you do the same thing as I. Sometimes, I mean, I find myself thinking about certain patients and cases, you know, outside of the time in the office. And I wouldn't be doing that if I was just, you know, thinking treatment. And I want to find, you know, the most elegant solution that will meet their needs. You know, and so I rack my brain on Saturdays and Sundays, like, how can I make this, like, you know, elegant?
Correct. So you agree the care and the treatments are different.
Absolutely.
Yeah.
And goes into the hospitality, which we love. And
that's where the care comes.
Exactly.
So this is where we are forgetting is the care. Care can be care as a treatment, and care is how you treat them as a human being. So there's always these two, the humans, the person, and the thing. For God's sake, I mean, 27 years I've been in practice. I know them every 3 months. They come for a cleaning. Just think about it. I have some of them, they know me before I got married, before I had children. And they're happy about saying it. Hey, I know him when he was single, you know, like, or he was dating her and whatever. So there is that part that is the care. The care has multiple meaning. And,
definitely.
And that's what we forget about healthcare. Health and care about the health.
Yeah.
So go back to us. Do you think, what kind of long-term relationship have we built with our patients? Not me, talking about all of us.
There's so many. Okay, first of all, let's talk about our specialty. Like perio, you better like your, you know, provider, because you're stuck with them for a while, right? Forever, basically. I don't think people realize that relationship. It's really the only one of all the dental specialties where you have a long-term relationship with people. And, you know, I really enjoy hearing the stories of my patients, especially, people who've been to war, people who've been like professors at, you know, Ivy League universities, and they tell me stories or recommend books, you know, philosophy professors who do that. I don't know. I love it. I love that kind of relationship. And I think, as I said, regarding my pharmacist, Donald, it makes my day, you know, and I think that in some ways we make theirs.
Indeed. You, my dear, what do you think we've built in this place, the relationship? So she's saying, I listen, I spend time with them, I build a relationship with them, basically. And is there anything you like to add to it?
No, I agree with everything that you said. I think that it comes down to the relationship. Why do they keep coming back to you specifically? And why your office, how does it make them feel? Going into like kind of looping everything together, it's not just the treatment. They feel cared for. The mouth is connected to a body, connected to a person.
It is. It's periodontics. You said it right. I mean, this is a lifetime commitment and journey.
A marriage.
It's a marriage, yeah.
But, you know, I was thinking...
be careful.
What's this?
The rate of divorce right now with marriages are pretty high.
Get out.
Hopefully, we are better than a marriage.
Yeah, exactly. We're better than a marriage. I have actually had patients who have been through multiple, you know, marriages.
Yeah, I can tell you many of them.
Yeah.
And I ended up treating their exes.
Exactly. But
we make sure that they come not on the same times.
And I'm sure this happens to you too, but don't you find that some patients are sad when they come to the end of a long treatment plan?
Yeah, I mean, look, the good thing is they're gonna come back for periodontal treatment and the maintenance. And one of the things that when when I started end of the 90s, 99, started private practice, there was the golden era. In what way? What way is, we used to alternate periodontal therapy, the maintenance. 3 months with me, another 6 months with the referral dentist, and so on and so forth. Until one day it became, how can I keep the patient and not let them go back to the periodontist, and so on and so forth. And that goes back to one essential thing, is that it's not transaction. People need to realize at the end of the day, you don't make a living out of the hygiene. Hygienists are very expensive, and they are getting increasing. I like to talk a little bit about business part, because you have to marry the ethics with the business. Hygienist or assistant, they were used to be paid $25 an hour. You can't find an assistant now for $35. Hygienist used to be paid $40 an hour. Now 60, 65, 70, and so on and so forth. The ones that come from school, they don't want to have more than that. So when you think about it, what's your margin as a dentist to make a living? But there is something more important, is when we do a treatment that is so involved, and you want to see the long term of the case, we are missing that beauty of the long term. You remember when we did that survey, the outcome? Nobody does outcome, I had people, it's funny how people answer differently. Somebody who had 27 years ago the treatment, and you ask them, how is it for you? They say, either agree or disagree. They say neither agree nor disagree. They pick it because it became part of them, so they don't feel that it's new for them. You see what I'm trying to say? Versus somebody 6 months or a year, they tell you, oh my God, I love chewing with it, and so on and so forth. We notice that, but nevertheless is that's professional satisfaction of seeing the case and how it evolves down the line. It's very important. It's not about the money, and that's where people misunderstand hygiene.
And actually, I think going back to corporate dentistry, that's what they're going to be missing. The original person who did the treatment is not going to see them.
Yeah, not only that, in our profession, in periodontics, let's put it this way. Let me give you another example. And again, I'm not here to judge or do anything, but I'm going to put myself in the patient's shoes. And I wrote it in the book. It's like, all right, so you have a periodontist that comes once a month or something, okay? Two things, the patient and the periodontist themselves. First of all, the periodontist or the dentist, they want to see the results of the treatment over time. They want to follow up that. Well, that's not your patient, in reality. It's not your practice, not your patient. Secondly, the patient needs a continuity of care. We know that we put an implant, but implant is, if not cared for, it's like a very expensive car. It needs actually more maintenance then. So if you don't maintain it, what's going to happen to it? It's going to break. So ownership of the case, the long-term care for the patient, and seeing your outcome. I mean, professionally, all of these, and for a patient, they are all very important. And that's what I bring back to anybody who's listening in the dental world, that it is so important to have that long-term commitment to the patient in seeing the result in long term. I hope you agree with me on that, but we'll see. Time will tell. If you would like to speak directly to a dental student or new graduate right now, what would you tell them not to rush into?
Focus on the basics of what you're doing. Start with your focus on the basics. Like start to why you're doing it. What are the different options? No shortcuts. I think just focusing on the basics, and then if you're interested in learning or broadening your scope of practice, look into high quality continuing education, just investing in yourself rather than just reading about it, taking a weekend course and going straight to patient treatment on a Monday.
I think I would recommend that they work in offices where they feel like, again, they belong, or they feel like the people in that office are like them. Because I know I have so many colleagues who just are not happy. And it's like, we're there all day. It's not worth it not to be happy. So be picky when you're, looking for a place where you're going to spend, most of your days.
So we're getting close to the end. 2 questions, or probably one. Cinzia and Anamaria, if you had to describe our practice in 1 sentence, what would it be?
Well, this is for both patients and colleagues. It's where you want to be.
And you, Anamaria?
I think if you want to be your best self, you have to train with the best. And I feel that you've really assembled a competent, talented, empathetic group of individuals.
Alrighty. And with that, I want to thank you both for making the time in the evening and for trusting me in your career and to be part of my team. I'm very grateful to you guys, and I'm very happy to work with you. I learn every time I meet with each one of you. And hope you have enjoyed that session. And till next time.